My charge this afternoon, though, is to look at this business of research and the role and value and direction of research as we think about current public policy. And it is an extraordinary time of public policy in early childhood. We've seen in the first administration lots of extraordinary things. The ARA funds came out, and then we had these things called Race to the Top, Early Learning Challenge things that I heard today, which is nice when you sit back and you hear it. That actually meant something to somebody that you worked that hard. And so I just want to think a little bit about where I see some big issues and talk a little bit about research. You know, I think what I came to realize in the 3.5 years in education and the 3 years at the State Education Department in New Jersey is that public policy has some multiple ways of justifying itself. And I think that for policymakers, these decisions you want to be based on some solid research foundation. So one good way is that there's a solid base of scientific information that supports the policy. John talked today about stricter regulations for lead testing that was based on some solid evidence. That's really good. However, while we can agree that public policy should inform, research should inform public policy, sometimes there are important public policy questions that simply don't have a research base, or somehow the research base doesn't quite get into the policy making. So I've got these two ways, I think, of justifying policy that from my experience alone, I speak for no one, here we go. So one of them is, we really, really want to do this. I mean, we just really, really want to do this. And there's a bit of research, and in this sausage-making world we live in, this is the best we can accomplish. So there will be some research somewhere done by someone that we will discover at some time that will support this policy. And I think that that happens because you want this thing to happen. And you know that the research doesn't exactly map onto it. And so you extrapolate in some way. And you come up with something that you hope will be a good thing. The other is, it just makes so much common sense to do this. It has to be the right thing because it makes common sense. And that kind of ignores the fact that the scientific method is intended to save us from our woefully imperfect perceptions. But it happens because it feels so good. And the public will say, yes, this is a good thing. Now, these may turn out to be good things or not. But the role of research in supporting this is often problematic. And so as researchers, I know what it is to sit and say, I know what this means. I know exactly what this means for whom, and look at that policy. But the policy has to fit, and it has to map onto something that may be bigger than the research. And so what I would like to see as I go through these issues is a greater kind of communication between policymakers and researchers. You know, I had to laugh because the first time I had to go to the Hill one Sunday was to talk about some piece of legislation, and I kept saying, well, the research said, and it took me about 3 times saying the research said to really realize that the research didn't matter for what we were doing that day. And that was the way it had to be because there were other issues that were involved. But on the other hand, I also understand what it is to hear that it's complicated, this very nuanced thing that policymakers don't have time to listen to. And so it's that give and take between the research that is, by definition, should be nuanced and carefully thought through, and policymakers who say, I have to vote, I have to write this piece of regulation, I have to do this and do it now. So how do we come together to think about this a bit more carefully? For me, there are some issues that in the current landscape I think are going to be important, and I just want to sort of share my thoughts with you about them. The significance of child outcomes, the increasing the scope of program impacts, cost effectiveness, and these issues of vertical and horizontal alignment. This issue of significant child outcomes has been around for a long time, and I think that as we see more and more public policy looking towards early childhood, it will be much more in the forefront than ever. I can tell you that for many policymakers, this is about the achievement gap. This is about closing the achievement gap, making sure that children enter kindergarten with the skills they need to be successful, and making sure they leave third grade ready to be successful for the rest of school. So it's not just kindergarten readiness, though that's a big part of the work we see before kindergarten, but it is making sure that that continuum of K to 3 is really in good shape so that kids are leaving third grade in good shape. So if that's what it's about, where is quality? How does that fit in? And I think from a lot of the conversations I've heard and been in, quality for professional development, for programs, is a means to achieving the end, which is improving outcomes for kids. And so in many cases, we talk about quality as the end goal. And I think that as we talk more and more about expanding preschool, really hunkering down, looking more and more about what's going on for infants and toddlers, and using federal funds, any kind of state funds, we're going to have to start to think about what does that journey look like? What does quality really mean, and what are the impacts that we're going to see for kids, and what does that look like? What factors can promote significant positive results for young children? Under what conditions will an increase in effective interactions produce child outcomes? We asked that this morning. How does improving the quality of professional development improve outcomes? And outcomes writ large, because it shouldn't be, and I don't think that there's much of an appetite right now for just a single outcome measure. I don't think we're looking simply at academic skills. There's a lot of talk about non-cognitive skills, all of these things for which we have some measures, maybe not the best that we like. So we've got to look across a broad range of domains and figure out what these outcomes should look like. When we announced the Race to the Top Early Learning Challenge, it was very clear in our talking points that this was about kindergarten readiness. However, we did focus on coordinating systems at the state level and looking at factors such as professional development and early learning standards and assessments. All those things were part of that project, but very clearly looking at kindergarten entry. So what's reasonable to expect for young children? What's not reductionist as we try to figure out what outcomes look like? I think these are going to be big challenges, but I don't think they're going to go away. I don't think we can ignore them. I don't think we should ignore them, but they're not going to be simple, because where children are, how much better children did because they were in programs that were funded is going to be a question that we have to answer. We also have this whole notion now of increasing the scope of the work. And so as the president announced in the State of the Union address, preschool that would be available not just for low-income children, but for children across the country. So now we want to make sure we get good impacts for kids, good outcomes, but we're increasing this to a broader range of children. And this notion of high quality for all children, what that looks like. So scaling up effective practices for more children. But then I think that leads us to a question of what exactly are we supposed to be doing for different kinds of kids? Will the same interventions produce the same results for all of these children? If we're no longer talking about just low-income children, what's the dosage? What's the intervention? What is appropriate for everybody? And so our questions have to get broader as we look at these new ways of thinking. If we're really talking universal, that is a different kind of question. And I think we have to be prepared to answer that. And all of these have to happen in the context of cost effectiveness. It's so interesting to be talking about a program to expand preschool across the country in the middle of sequestration. So we'll see what that looks like. But I think we have to look always in terms of limited resources, certainly at the state level, and the need to be good stewards of public funds. So we're back to the hope that research will provide answers for us, answers that tell us what works for whom, under what circumstances, so that policymakers can do a better job of targeting these interventions, of targeting resources so that the interventions are appropriate and effective and we know what we're doing. Just to give you a quick example, have you flashed me anything yet? Oh, sorry. Because I can't see over there. Oh, thank you. When I sat as the assistant commissioner for early childhood in New Jersey, we were in charge of Abbott preschool programs, 15 kids in a class, lots of good things going on. And I remember the commissioner coming in one day and saying, listen, we got to raise this class size. We can't afford this 15-kid thing. Like, it's like, really? And she said, well, do you have research that says that we're going to get better outcomes if we have 15 as opposed to 17 kids? Because it meant a lot of money. It meant fewer classes, fewer teachers, less money in space. It was huge. And so the kinds of questions that come up that are real cost-effective questions aren't necessarily questions that people are trying to lower the quality. So that's not always the debate. It's not, we'll just reduce the quality. Now, that can happen. But how do we make sure that we have the quality we need to get to the goal and the most effective way? John talked today about an effective and economic vehicle to success. I like that. I thought that was really good. I think there's an appetite right now for reaching large numbers of children with strategies that result in significant positive impact at low cost. And so as you think about the strategies that are out there, you know, the notion of how we can reach people, what are cost-effective ways? Because cost is going to be a factor. And then we have this business of vertical alignment. If you look at the Department of Education's strategic plan, it outlines an early learning agenda that goes from birth to third grade. And that was a lot of conversation, a lot of to-do about that. But I think that was the right thing to do if we think about this continuum called early childhood. And the calls for preschool come with a desire to increase the quality of programs for infants and toddlers. So the president's new agenda isn't just we'll have more preschool, but really talking a lot more about how we can better align early Head Start and child care and have really good programs across the continuum. Doug spoke today about learning trajectories, and I think public policy gets a little complicated here because the mechanism we have is what I think of as a kind of arcane system that has these artificial blocks along this early childhood continuum. So suddenly, at kindergarten entry, this child who was in preschool is different and needs different kinds of things. Not really. Suddenly, we go to first grade and things are different. They shouldn't be. I think we need to look broadly, much more broadly, across what we know as child development and see if we can tinker with these systems to get much more aligned with that. You know, Marty said this morning that she was concerned that the early childhood community was going to be held responsible for what happened sort of afterwards. And there is a lot of concern about preschool programs being evaluated in some way that is not quite right and looking farther ahead. But I guess I sort of think that I'd be concerned that the early childhood community needs to own that entire continuum from birth to third grade. And I think we have not, as a group, looked carefully enough at what quality looks like in that K-3 continuum. And I think we need to push much harder for public policy that speaks not just to birth to 5, but that goes along the continuum to speak up to third grade. It's hard. The mechanisms are different. The federal government has very strange ways of funding this work, and it always has. The Department of Education has been primarily working with states, and states have the responsibility for K-12 education. They tell us all the time that they have the responsibility. On the other hand, our preschool endeavors, like Head Start and child care, have been basically run by federal kinds of funding. So how do we take that sort of mishmash of funding streams across this very strange kind of continuum and find some way to have good quality across the birth to third grade continuum that really doesn't have a kind of segmentation and isolation that it can have? I think we've had good efforts to really try to make this work across the continuum, but we've got to. And so when we talk about quality professional development, I'd like to hear about quality professional development across that continuum. One of the things we funded in New Jersey was a P3 certification. You know, teachers going back to school and got this P3 certification. And the truth is, I really believe that the university stepped up to design very good preschool programs that would train teachers for preschool. I do not believe that we did a very good job of training teachers across the P3 continuum, even though they had P3 certificates. So I think we have to figure out how we make all of that work so that a teacher is able to look across and not just be segmented into one age group. We had a day at education when senior staff shadowed teachers, which was a great opportunity for us to get out of the building and actually into the world we think we are going to try to have an impact on. And I had this great honor of shadowing a teacher in a Montessori school. And she had 22 kids in her class, and they were aged 3, 4, and 5. And she was either on drugs or tremendously zen because she just was very calm. And she had a real understanding of how each child was supposed to interact with materials. She had a real understanding of what the expectations were. She also knew those children. They were with her for 3 years. They knew her, she knew them. It was, to me, a model of what I would like to see teachers able to do. Because I thought, what if these 3, 4, and 5-year-old children were all the same chronological age, but with different levels of ability and maturation? We'd say the teacher can't do that. How can we possibly expect anybody to do that? That's not reasonable. Yet it has to be reasonable. And so when we talk about higher education and how we're training teachers, let's really think about how we train them more broadly. I think in many cases we're training them for way too specific a thing, and kids don't act that way. Children don't come in with this very singular way of being. So I think that kind of alignment is important. The horizontal alignment is also really interesting to me. I loved Marty calling John an Uber integrator. I thought that's kind of cool. And it was very, very heartening for me to listen to Lisa talk about Race to the Top as this mechanism for greater integration. That was our goal. There isn't much interest, I think, right now in having new federal programs. Even when there's conversation about expanding preschool, I don't know that means, I don't think it means a new federal early childhood program. So there's not a whole lot of interest in that. But how do we take the programs we have and make them more effective, align them better, put them together as they focus on very different things? There are some programs that have focused on comprehensive services, such as Head Start, other programs that really haven't. How do we figure out what we think is important? And that has to go, I think it should go across health and educational levels. We should be looking at these social emotional skills that we now know are tremendously important. And I think this notion of coordinating these systems at the state level in particular, I think is going to be critical. One of the best parts, I think, of looking at that fierce application for the Early Learning Challenge was the first piece when states absolutely had to sit back and say, what are our resources in early childhood across the state? And we found that in some cases they had never had those conversations before. That's important. So how do we have that kind of alignment? And I think for the researchers out there, it's always this notion of how do we get generalizability in our work, because that's what we do that. But how do we get generalizability in a way that's going to tell us specifically what we do for different groups? It gets complicated again. It gets to the point of knowing how many different kinds of populations are we going to be dealing with, different kinds of teachers, what professional development, what works best for whom, and yet how do we get more specificity? So generalizability, yet more specificity, but I think more of a sense of, from a policy perspective, what do we think is out there that we need to address, and what do we think is coming? So I think sometimes we have to get ahead of the game. And try to talk with policymakers and see where they're going to find out what their questions are. Because if there is no research to support the policy decision, it doesn't mean there's not going to be any decision. It means that it'll be a decision that's void of information and research. I think one of the things, I remember a congressperson telling me, these researchers come and the only thing I know they're going to agree on is that they need more research. And he's not wrong. But think about what it is to have conflicting research, or research that's, and you're like, well, not quite. And I know what that's like, because you sit at a meeting and people are saying, well, what's the research in that? And you say, that's not quite what the research says. And it's maddening. So I think this ability to have this kind of dialogue, we talk about a dialogue of research to practice. I'd like to see a dialogue of research to policy. What are the kinds of things that these policymakers have to do? And what kind of research can we have to speak to it? You know, I lived a bit of my life in the research division at ETS, and I look back on those times and I thought, I had no clue what policy meant. I had no clue how to make a policy decision. I only knew that I had questions that I wanted answered that I thought were tremendously interesting. And that's all good, but it has to have some impact. And the way you have real impact is on policy. I mean, this is where lives are changed. These are huge amounts of money that, if we use it well, will have a tremendously important impact on children's lives. So what works for whom, under what circumstances, my question that I leave you with. And I think that this work of professional development quality is absolutely critical. We believe that the person in front of that child every day is the really important factor in what happens in these programs. We just have to know what they need to know, how they get to know it, and how they can have an impact on children's lives. Thanks.